public vaccination team plan to deliver between 180 and 216 booster jabs every weekday and around 450 per day at the weekends. But given that this is the third campaign, it's a pretty well-oiled machine.
It's going really well. We've had a very good outcome with the elderly population. We have organized it in a way that it's seamless for the patients. We have located this in the Children's Health Center, thinking of a clean area for the most vulnerable. We have like 12 to 14 vaccinators in place, and they've all been trained up to standards, very well trained by our practice development system, and they are doing really well. I mean, the outcome is really positive. We know what the process is. We know obviously what the advantages and disadvantages, the logistic side of things. We already know, how to sort of manage it and run it appropriately so that it runs smoothly, especially for the most elderly.
Look, we had the vaccines back in February. 8 months have gone by. I think a booster is terribly important. But at this time of the year as well, now autumn coming up, colds and so on, I think it's vital.
It is very important. You can give it to other people even though you've had the 2 flu jabs, you could still get it. And being 80 years old is vital.
Everything that's good for us, I think they're doing it for the best, no?
Booster vaccines start at 5 until 8 weekdays so as not to disrupt services at the Children's Health Centre, and from 8 till 5 over the weekends.
I think possibly people now know what to expect from the vaccine. They now know what society is asking of them to be able to move around and travel. It's very much an individual choice. But I think we've seen that in many cases that people who are reluctant to have the vaccine before have now actually called us eager to have the booster. So things are changing.
It's very, very important that you do continue to have the booster vaccine. If you've already had the 2 previous ones, then it makes sense to carry on with the booster. I'm very happy about that.
Let me just ask you, did you have any reaction to the previous one?
Not at all, none whatsoever.
I've been cutting down my activities recently. Now after the booster I'll be able to be a little bit more active and go out a bit more.
It is a safeguard. So I think people should have it.
I can assure you that we've got lists which cater for every single member in the community, and everybody who's 50 and over will be getting a call from us in the next few weeks. The only thing we do ask is that people bear with us. We are actually calling about 1,000 people a day. We have about 12,000 people on our lists, so we can't possibly call the 12,000 in one day. So if you haven't heard from us by the time we are in the next 4 weeks, then by all means call us. But please bear with us. We are really trying to go as fast as we possibly can, and we will get it to you.
Those interested in having their booster vaccines should register their interest on gha.gi/pfizerbooster.